These are risk factors for perioperative apnea in pediatric patients. There are a few primary risk factors. Patients that are preterm, the less than 60 weeks post-conceptual age, are at risk. Patients with anemia, specifically a hematocrit of less than 30%. Patients with a history of apneic episodes are more likely to have future apneic episodes. Babies with chronic lung disease like respiratory distress syndrome or its sequela bronchopulmonary dysplasia, other comorbidities, and parental cigarette smoking are all the primary risk factors. There are some important clinical points. The risk is highest in the first 12 hours after anesthesia. Apnea can occur even in a patient that was previously apneic-free. So even if the baby is breathing normally after the surgery, you still want to be very wary for the first 12 hours after the procedure, even if they didn't originally have apnea after the procedure. The risk exists both after general and regional anesthesia. So if they got a spinal, epidural, or caudal block, they still are at risk for apnea if they have these risk factors especially. Standard practice is to monitor at-risk infants for 24 hours post-procedure, so they don't always get discharged after a procedure. Management approaches: the treatment includes tactile stimulation or bag mask resuscitation for an apneic infant. Preventative measures include caffeine, CPAP, and monitoring in the ICU, as we said, for 24 hours post-procedure.